Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Advancing Healthcare Awards AHA 2024 nomination edition. This audio podcast as part of a chartered edition. This audio podcast as part of an evidence-based edition. This audio podcast as part of a blast feature, and this audio podcast as part of a Storm Lobostics production. So I'm following on from the audio podcast in this particular edition, and as part of this particular edition, this audio podcast will now look at the category in regard to or regarding the Academy for Healthcare Science Award to recognize emerging leaders in healthcare science. So one of the initial questions is part of this, or one of the initial sort of questions as part of this this category is as thus: summarize the person's achievements and significance and its significance. So encouraging all healthcare professionals and renal patients is where efforts have been focused through the RPSG, the Renal Patient Support Group, established in 2009, and the Kidney Disease and Renal Support Group, or KDARS group for kids, established in 2014, and wherein Shahid has prompted evidence-based collaborations between clinical and academia to enhance patient care. One of the sort of additional questions as part of this category is to provide a fuller description in around the achievements and impact. So patients and carers are often have varying questions relating to kidney care following a routine clinical outpatient appointments. The RPSG and KDARS platforms are co-developed social media platforms that link evidence-based and scientific practices to support adults and pediatrics and young people suffering with varying forms of kidney disease. Service users utilize the RPSG because of its essence of involvement through social media platforms, and this provides opportunities for patients, professionals, and researchers to work collaboratively and in partnership. KDARS is the pediatrics and young people equivalent of the RPSG, and supports those in varying forms of kidney disease from ages neonate or 0 to 18. Shahid has provided multidisciplinary team working perspectives between healthcare sectors and in various settings surrounding research and industry. And so with over 2 decades of healthcare research and scientific experience, Shahid has published over 350 publications, including systematic reviews, literature reviews, mixed methodologies publications, narrative reviews. And so, owing to Shahid's acquired skill mix across scientific practice, the RPSG has over 10,000 service users globally, and the KDARS has over 2,000 internationally. The RPSG and KDARS are platforms for all. Another question as part of this category is: what are the outcomes and benefits in terms of improved service delivery? So between the two social media platforms, there is and have been vibrant online communities that have wanted to drive and integrate kidney care awareness and research with an ethos surrounding evidence-based medicine and healthcare with scientific practices. RPSG and KDARS portfolio highlights evidence-based practices between frontline and allied health professionals or AHPs, and where the focus to enhance patient services has surrounding health education, thus to increase healthcare language and literacy. The RPSG and KDOS platforms have historically been represented through Shahid's leadership for online renal populations that would otherwise be perceived as obsolete. Shahid has been involved in the development of practices representing RPSG and KDOS through working groups and panels, working groups and panels from 2009 to 2011, and 2011 to 2014, and 2010 to 2013. Shahid's collaborative efforts throughout the RPSG and KDOS has prompted efforts between nephrology, pathology, and pathology services for pediatrics and young people and adults and adults with renal conditions. The efforts have been international, so that awareness and research so that awareness and research outcomes surrounding RPSG and KDOS platforms are disseminated through the public domain. In around another sort of question as part of this category, how would you describe the leadership style? So between the two platforms, there is and are patient focused founders and co-founders, administration and moderating teams aligned with Shahid's leadership. Through collaborative efforts, Shahid has formed several publications and presented work locally, regionally, in various European countries, virtually and internationally. There has been a science focus throughout to encourage patient and healthcare professionals' involvement to work together in meeting mutual objectives regarding scientific practices, primarily linked to the National Institute for Health Research or NIHR involvement framework, and additionally toward National Institute and additionally toward the National Institute for Care and Excellence and a Medical Research Council remits. The leadership style throughout prompts peer-reviewed works across social media platforms. One of the sort of final questions then in this category is what would colleagues say about this person? And the responses is one of the response has been Shahid has a detailed intrigue in nephrology, pediatric nephrology, and immunobiology. A passionate individual and always about science. And the final question, in around this category is what might the future hold for the person in terms of contribution to healthcare science. So number one, to investigate the importance of reducing nephrotoxic immunosuppressives in pediatric transplanted recipients based on original works from 2003, initially potentially carrying out a systematic review. Number two, to integrate research that includes comparing use of biomarkers in the screening of chronic kidney disease, CKD, and renal insufficiency. So for example, biomarkers such as cystatin C, neutrophil gelatinase associated lipocalin, creatinine or serum creatinine, and fibroblast growth factor 23, FGF23, in a pediatric population with potentially with a pharmaceutical industry collaboration. And three, to identify opportunities for a multi-center study to develop a formal coping framework based on original research works from 2016 and 2015, 2016, and collaborating with international teams conducting similar research. So that draws this audio podcast to a close. This audio podcast as part of an Advancing Healthcare Awards AHA 2024 nomination edition. This audio podcast as part of a Charlotte edition. This audio podcast as part of an evidence-based edition, and this audio podcast as part of a blast feature, and this audio podcast as part of a Storm Robotics production.